KIIS FM.
This is the KIIS FM Community Council.
Thanks again for joining us today. If you're just tuning in, we're the show that talks about everything great in the community. We're also here to show love to all of the amazing nonprofits out there trying to make a difference. And with me, I have on the phone Dr. Nikki Gidwaney. How you doing?
I'm well, thank you. Thank you for having me.
Thank you so much. I'm great. Thank you so much for being here. And we're going to talk a little bit about National Breast Cancer Month.
I am so excited. It is such an important topic, and thank you so much for making that a highlight on your program today.
Absolutely. So let's jump right into it. How common is breast cancer in men?
So that's a really good question because we hear so much more about breast cancer in women. It is not very common in men. So statistically speaking, 1 in 1,000 men will get diagnosed with breast cancer, whereas for a woman, it's 1 in 8 women will get the diagnosis of breast cancer. So that's a huge difference.
Why is this statistics, I guess, so common for women and so uncommon for men?
Well, the natural tendency is for the breast cancer to develop in tissue that is conducive to growing the cancer. So the female breast and the female body has more of the hormone estrogen, which can result in development of many types of breast cancers. And for men, typically they don't have as much estrogen and they don't have a lot of the breast tissue. So the chances of getting breast cancer in men are therefore much less.
Should men start getting mammograms?
No, because from the fact that getting breast cancer in men is so uncommon that the screening thousands of men to find 1 or 2 cancers does not make sense. But it's important to recognize what the signs and symptoms of cancer could be in a man so that they can get the right diagnostic test if necessary. And it's also important to recognize the subset of men who may be at a higher risk of developing breast cancer and perhaps screening that subset of population. Now, when I say patients with that higher risk, well, those could be males who have a family history of breast cancer, men who have the genes, BRCA1 or BRCA2. There are several other genes as well, but those are the 2 most well-known. Men who might be at a higher risk due to prior history of chest radiation, and also any other conditions that can predispose them to having higher levels of estrogen in the body, such as liver disease or obesity. They should just be on a slightly higher level of alert if they do feel something in their breast.
Absolutely. Can we go through some of the symptoms?
Absolutely. So it's really, for women, typically, their cancers will get picked up on a mammogram most of the time. For men, like we know, they're not going to get the screening mammogram. So for them, they have to be very vigilant about anything that they feel that's different in their breast tissue. So if they feel a hard lump, either behind the nipple or in the breast, they should definitely have a doctor check it and then see if they need to have any type of imaging. Also, if they happen to feel lumps under their armpit, then that's also something that they should be looking into and getting themselves checked out. And a lot of times what we see is in men, they'll actually come to the clinic a little bit later than they would have typically, because oftentimes they may attribute these symptoms, such as the hard nodule, to maybe having a bruise, or they might have had an injury. They might think it's a pulled muscle. So certain times we do see that they'll delay their care because the idea of having cancer in their breast does not come as a first line thing. And then it's also important, to, like I said, for the patients who are potentially at a slightly higher risk, for them to have regular checkups.
What should men do when they have concern about their breast?
The first thing would be is see a physician, see your primary care doctor, who can then at least do a physical examination. And then usually what happens is their doctor will then have them sent for imaging, which would usually include mammogram and ultrasound. And if there's still a potential concern, then sometimes they can get MRIs for further testing. But the first line would be to have a doctor check out and, make sure that they can do a thorough physical examination for any concern that a patient feels in their breast.
Absolutely. So, listen, are there any differences in the kind of breast cancer and treatment of breast cancer between men and women?
So typically, there's not a huge lot of differences. In fact, they're the same type of cancers that can occur in both men and women. The treatment is also very similar. Sometimes, though, we do see the fact that, women tend to, if their cancer is small enough, they can get a lumpectomy and have a breast conserving method of treatment, whereas for men, they usually elect to have a full mastectomy just by the sheer fact that there's not a lot of breast tissue to conserve.
Mm-hmm. Okay. Are there any differences in how men and women cope with breast cancer?
That's a great question, and it's so important to highlight that because even though their surgical and medical management can be similar, the way that they get their psychosocial support is very different. Mm-hmm. So we oftentimes see breast cancer as a female disease. We see with pink ribbons. We see a lot of attention given to it amongst the female population. There's a lot of support groups that are there for each other when a woman gets diagnosed. But we don't have that same setup for men. It's usually, is not something that people think about when they think of breast cancer. It's not something that they think about as being a men's disease.
Right.
So first and foremost, right, the first and foremost thing is that it could potentially carry a stigma that it's a woman's disease. So men might feel shy to talk about it, first of all. And in general, men don't usually talk about their health to other men. So there's not a lot of support networks available for them. And then just by the sheer fact that there's not a lot of men who have breast cancer, the support systems aren't really as big and as rich for them to be able to get those resources.
Absolutely.
So they tend up. So unfortunately, men, when they get diagnosed with breast cancer, tend to be more isolated, and perhaps, there are times where they can, battle with depression because of that isolation.
So let's jump into women. Like, when should women start getting screening for breast cancer?
That's a very important question. And the recommendations by the American College of Radiology and Society of Breast Imaging do suggest that women starting at the age of 40 should get their screening mammograms on an annual basis. Mm-hmm. And women who are at a higher risk can actually start screening earlier than that, based on their own risk profile, which they should discuss with their physician.
Absolutely. Is breast cancer genetic in men as it can be in women?
Yes, absolutely. So we do know that there are certain types of breast cancers that do carry a genetic predisposition. And so both for men and women, if there is a family history, then they should be looking at it as a potentially genetically carried disease, both for men and women. Mm-hmm. But again, not all cancers are genetic. So we have to take into account that most of the breast cancers are not actually genetic.
Right. So what advice do you have for the men that's listening right now? So my key takeaway message would be, don't ignore something that you're feeling in your, breast/chest wall. It's really important to be on top of your health. I know it's easy to let go of things and think that they're probably nothing and, keep moving on with their busy lives. Mm-hmm. But really, if you do feel something and you notice that there's a difference, please don't ignore it. Please make sure you have a doctor look at it and evaluate it so that you could hopefully come, get yourself evaluated sooner and get the treatment sooner. Because it's, like I said earlier, women will get their screening mammograms every year, and, we can pick up their cancer much earlier. So we find the smaller cancers, and the earlier detection obviously leads to a much better prognosis for them long term. So their survival rates are much higher. For men, because they don't get themselves seen up until the point when they feel something, usually they get diagnosed at a later stage, mm-hmm. and therefore
have a lesser success when it comes to treatment. So we do see a higher mortality rate with men developing breast cancer versus women.
Absolutely. Dr. Nikki Gidwaney, thank you so much for coming on and speaking with us about National Breast Cancer Month.
It was my pleasure, and thank you so much for promoting this awareness.
Absolutely. Thank you.
Thank you. Take care.
You too.